So the trials that look at the extended therapy really are looking at several groups of people. The patients who started with the tamoxifen, those are the subject of the ATOM and the ATLAS trials in particular. And these were a group of women who received 5 years of tamoxifen. And then the trials were really conducted to see who benefited from 5 additional years of tamoxifen. And we know that women who start with 5 years, if you expand it to another 5 years of tamoxifen, these women generally seem to benefit from the expanded therapy. If you started with an aromatase inhibitor, for example, which is the subject of other similar trials that looked at either a tamoxifen aromatase start, like the MA17, the NSA-BP trials. These trials in general had a disease-free survival benefit, but less of an overall survival benefit. And then finally, looking at starting with an aromatase inhibitor and continuing with an aromatase inhibitor, again, there may be some disease-free survival benefit, but not overall survival. And lastly, looking at trials where even if you started an aromatase inhibitor, do you need to continue this on for 10 years? And one of the trials in that space is the IDEAL trial, where patients got either tamoxifen or aromatase inhibitors to begin with. And the question is, how long of an aromatase inhibitor would you need? And it seems, at least from the trial data, that 7.5 years may be just as good as 10 years in that patient space.